Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. April Kapu. She's joining us here as president of the American Association of Nurse Practitioners, and she's also a certified acute care nurse practitioner herself. She's joining us to talk about the purpose of National Nurse Practitioner Week, which is November the 7th through the 13th. She's going to touch a little bit on the dedication and commitment of NPs during this last year and a half or so treating COVID-19 patients, and also a little bit on how the role and responsibilities of NPs has evolved during this COVID-19 pandemic. Quite a bit to talk about in a very short period of time. Welcome to Health Professional Radio. Dr. Kapu, thank you for taking the time this morning.
Well, thank you for having me. It's great to be here.
Well, I'm glad that you decided to take the time this morning. Give us a little bit of your professional background and talk a bit about your role as the president of the American Association of Nurse Practitioners.
Yes, so like you said, I'm an acute care nurse practitioner, so my background is really working in the ICU as a critical care NP, cardiovascular ICU, and then more recently I have moved to the Vanderbilt University School of Nursing as the Associate Dean for Clinical and Community Partnerships. Okay. And yes, I am the president of the American Association of Nurse Practitioners. We represent over 325,000 nurse practitioners nationwide. So we're actually the largest nurse practitioner organization in the world.
What is it that you help your members with? Is it with professional advice, mental health? What types of support does the association offer its members?
That is a great question. So we are a membership organization. So our organization is all to support the members and their practice. So we have an acronym called PEARL, and that is that AANP supports nurse practitioners in practice, education, advocacy, research, and leadership. And so we provide different types of support, certainly legislative support on a national, local, and state level, but we really want to promote nurse practitioners in the very best in practice, delivering excellent patient care, research, and education of nurses, nurse practitioners, and other healthcare providers, as well as our patients.
November the 7th through the 13th, National Nurse Practitioner Week. How long has that been established?
Well, we've had National Nurse Practitioner Week as long as I can remember, okay. And it is really to celebrate our nurse practitioners everywhere and the patient and what they bring to their patients.
As far as the problems that the pandemic has caused, I mean, they're too numerous to even mention, but we all see the effects. We hear of disparities in care. We hear of shortages around the world in just about everything, every product, every service. There are shortages. Is there a shortage of nurse practitioners due to the pandemic?
Well, we have seen an increase in nurse practitioners because our profession is growing. It's one of the top growing professions because we really are meeting the demand, the needs for access to care. Certainly in rural areas, many nurse practitioners are moving to work in rural areas so that people who live there have access to care. The pandemic has been a stress on everyone. Certainly, I totally agree. But nurse practitioners have been on the front lines of the pandemic since the beginning. They have set up testing centers in the communities, in churches, community centers, mobile testing sites when the pandemic first came to the United States. And then they helped quite a bit with developing standards of care as patients were moving into the ED and into the hospital. Nurse practitioners have been really working to provide telehealth as well as seeing patients in the home. And so and then now they're very involved in vaccinations and making sure we have vaccination availability throughout our communities and answering a lot of questions. People have a lot of questions about the vaccine, and so nurse practitioners are there to provide accurate information.
In my experience with nurse practitioners, you all might as well be your doctors. What, in your opinion, is the reason for the boom in nurse practitioners as opposed to physicians taking on a bit more of the responsibility themselves during this pandemic?
Well, we are nurses. All nurse practitioners are registered nurses who have gone back to school for advanced nursing education. So we have advanced education in nursing, we have clinical training, and we're nationally board certified to care for patients in different areas. We diagnose, we interpret tests, we order tests, we prescribe, and that includes prescribing medications, and we care for patients across the lifespan in all healthcare settings. So we're a very important part of the healthcare team. So we have physicians, we have nurses, we have nurse practitioners, we have all the members of the healthcare team, but nurse practitioners really work to provide comprehensive care. We care for the whole patient, everything from where they came from, how they got there, their job, what they do, all that matters because that helps them to get engaged in their health care and it empowers patients to take control of their own health.
Are you actively engaged in recruiting new NPs, or is this something that there is such a demand and interest in the field that you really don't have to recruit? You just open the doors and there you have your new recruits.
Well, it's a little bit of both. So many nurses are looking to go back to school and provide or become a nurse practitioner so they can provide that care across many healthcare settings. So it's a little bit of both. What we're doing this week with National Nurse Practitioner Week, it puts a lot of information out there in the media and other venues so that nurses can see this opportunity and they can look and see if this is something that might be right for them. One of the things I think that's really fascinating about Nurse Practitioner Week each year is that we have elected officials that actually proclaim nurse practitioner as this week as National Nurse Practitioner Week. So they sign proclamations, and in those proclamations, it talks a little bit about what nurse practitioners do, and then certainly honors them for all the work they do. And so this year, we've had already over 40 governors sign proclamations across the United States proclaiming this to be National Nurse Practitioner Week and honoring nurse practitioners for what they do. So people see that, patients see that, and so we see that growing need for nurse practitioners and more nurses saying, you know what, that's what I want to do.
Is there anything that you'd like to add for our listeners about the association or your particular participation or anything at all about the commitment that nurse practitioners have shown during this pandemic and before and going forward?
Yes, this year more than ever, we really are so grateful to nurse practitioners for all that they have done throughout the pandemic. We are just continually amazed. I'm a nurse practitioner, but I'm continually amazed at my colleagues and how much they give over and over again to care for others. And so if I was going to say anything this week to nurse practitioners, it would be, you know what, this week, please take a moment to care for yourself. Put yourself first and provide some self-care so that you can continue to bring your very best self to your patients. Remember why you became a nurse and bring that why each and every day so that you can provide the very best care to patients and their families.
Dr. Kapu, I appreciate you joining us here on Health Professional Radio. Give us a website where our listeners can learn more about your association.
Sure, lots and lots of information about our association as well as nurse practitioners on aanp.org.
Again, thank you, Dr. Kapu. It's been a pleasure speaking with you, and I'm hoping that we'll have an opportunity to speak again in the future.
Nice to talk to you today. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.